Hi, I'm Renee. I'm Dr. Gazzelli's physician assistant and second pair of hands during surgery. You are getting ready to have an anterior cervical discectomy infusion. Today I'm going to walk you through the procedure and recovery period from start to finish. Please feel free to take notes. I'm happy to answer any questions that you have or go into any further detail with you face to face. This is not meant to be comprehensive, so I do anticipate you'll have questions, but hopefully it gives you a good amount of information about the procedure, day of surgery, recovery period. So in the pre-op holding area, you'll be brought back prior to surgery. The nurses will get an IV started and get things prepped and ready. They'll make sure all medications and past medical history and all information is updated in the computer. You will meet with the anesthesiologist before surgery, and sometimes they even call you the day before surgery. So if you get a call from a number you don't recognize that day before surgery, you may want to answer it, as it could be that anesthesiologist just wanting to get to know you and chat with you a little bit. You will also see Dr. Gazzelli before surgery in the pre-op holding area, so he can answer any final questions that you have at that time as well. As far as the approximate time of the procedure and what your family should be expecting, typically a one-level fusion will take us about an hour and a half. A two-level fusion will take us about 2 hours, and you could add about 30 minutes for any subsequent levels you're having. We're always happy to keep all family or friends or whoever's with you updated and informed throughout the surgery. The nurses in the OR can call them and let them know how things are going. Dr. Gazzelli will also call them and come meet with them face-to-face after the surgery. So if they're there in the facility, he'll come sit down with them and chat with them. If they can't be there, he is happy to just call them on the phone as well and update them after the surgery. As far as what happens in the operating room, you've probably already watched the procedure video, so you're a bit aware of that. But this is going to be a little bit of a recap of the surgery as well as some commonly asked questions that people typically have. The procedure itself is done under general anesthesia. We also have people in there monitoring your spinal cord and spinal nerves during surgery. So after you're asleep, they're going to put little baby needles all over from head to foot. And that monitors the spinal cord and the spinal nerves while we're operating, so that if anything starts acting abnormally, they'll let Dr. Gazzelli know right away. I also mention them because if you wake up with pinpricks, bruises, and bleeding, that's what that was from all those little needles. The incision with this procedure is typically always made on the left side of the front of your neck. There's no big muscles that we cut through during this procedure. There's just a small, thin one that we go through, and that really helps this surgery not be that painful. And once we get through that thin muscle, we'll just be able to push things aside and slide down to the spine. And once we get to the spine, we'll bring in a microscope so that both he and I can see everything nice and clear. We'll then remove any disc material, bone spurs, or anything that's pushing or pinching on the spinal cord or spinal nerves. We always will open up the nerve canals on both sides, both left and right. Even if your symptoms are more right-sided or more left-sided, we'll open up both sides. Once we've done that, we can put the bone graft in place, and once all levels are done, we'll put the plate on the front with plate and screws. And once the plate is on, then we can go ahead and close the incision. The incision is typically closed with all dissolvable stitches. The top layer is also dissolvable. However, I don't like putting big knots underneath the thin skin of your neck. So typically I'll leave a little tail end of that suture. If you were to see it at any point, it looks like clear fishing line. However, I will tape that down and cover it with a white steri strip or skin tape, so you'll see that on your neck. That will then be covered with a gauze bandage, and then you'll end up waking up with a collar on. If it's a one-level fusion, you'll have a soft collar. If it's 2 or more levels, you'll have a hard collar. Then you'll be moving to the recovery room, and in the recovery room, the nurses will watch you as you're waking up, make sure you're waking up okay, and that they're helping to control any pain that you do have. We may have put a drain in after the surgery, and so if that's the case, the nurses in the recovery room will watch and monitor that drain. And as long as it's very little drainage, it will be removed before you go home if you're leaving from the facility that day. If there's a little bit more drainage, then we're okay with them sending you home without it. We actually will leave the drain in, and you can go home with the drain if you're still leaving that same day, and then you'll just come into our clinic the following day and we'll remove the drain. That doesn't happen very often, but I mention it because it has happened where we've sent people home with drains when they're still ready to go home that same day of surgery. If it's a multi-level fusion, 3 or more levels, oftentimes we'll keep you in the hospital overnight and the drain will stay in overnight as well. The nurses in the recovery room will also watch your swallowing. Because we're going through the front of your neck and operating around the esophagus, there's a little bit of post-op inflammation and some swelling, and that can cause you to feel like there's a lump in your throat and for you to have a little difficulty swallowing at first. So in the recovery room, we only allow the nurses to give you liquids. As long as you're swallowing liquids okay, they can step it up to soft, regular food. And you'll continue softer foods initially as your swallowing is improving, and then you can advance it to more regular food once you're comfortable with that. So softer foods like soups, pastas, applesauce, pudding, yogurt, things like that that are easier to swallow. I also recommend that you keep a good glass of water or something to drink if you feel like something is getting stuck, like a piece of food or a pill or something like that. As far as discharging you home, for a 1 and 2 level fusions, typically this is an outpatient surgery and you do go home the same day. For 3 or more levels, we typically will keep you overnight in the hospital. So you will be discharged home once you are awake, you're swallowing okay, and pain is relatively controlled. They'll also make sure that you're getting up and walking all right before you go home as well. We do give you pain medications and muscle relaxants after this surgery, and oftentimes we will give these to you prior to surgery at your pre-op consent appointment, so you can fill those ahead of time and not feel like anyone has to worry about filling them the day of surgery. We do give you antibiotics during the procedure, so we do not send you home with antibiotics. It should just be the pain medicine and muscle relaxants that you will have at home. And for fusions, I always want to remind people we ask that you take no anti-inflammatories for 3 months after surgery. That entails or means Advil, Aleve, ibuprofen, Motrin, naproxen, any of those medications over the counter or prescriptive. So none of those for 3 months. Tylenol would be okay as far as an over-the-counter medication. If you are staying overnight, we have a spine and orthopedic floor that you will stay on, and there are nurses and physician assistants that work on that floor regularly and know how to take care of a spine and an orthopedic patient. You'll also meet with a physical therapist and occupational therapist while you're there to help you with daily living activities and getting up and moving and walking around. You will be in a gown most of the time, but you're welcome to bring loose, comfortable fit clothing to wear there, or especially just to go home in when you do go home. You're also welcome to bring any toiletries or things like that from home if you wish as well. All the rooms are private, so you will not be sharing a room with any other patients. And while you are there, you will see Dr. Gazzelli or myself on a daily basis. If you're there over the weekend, you will see Dr. Gazzelli or myself or one of our other surgeons or physician assistants that would be on call that weekend and would be monitoring or seeing all of our inpatients. As far as what to expect initially and the restrictions that we ask you to follow, swallowing is something we continually talk about, to watch your swallowing, keeping your diet soft until you're more comfortable swallowing more solid foods. For 1 or 2 level fusions, it typically gets better as far as your swallowing goes within the first week or 2. Some people it takes a little bit longer. It's just a slow improvement where that post-op swelling goes down and you're able to swallow things more comfortably. As far as activity restrictions go, we do ask that you not do any lifting greater than 10 pounds the first 8 weeks, and no real overhead activities where you're having to put your head up like this for about 3 months after surgery. Walking is going to be your main activity and main therapy that first 8 weeks. So I want you getting up and moving even immediately after surgery, later that day or the next day. I don't want you bedridden or chair-ridden after this surgery. So even if you're just at home watching TV or reading, make sure you're getting up every 45 minutes to an hour to walk around the house, go get a drink of water, go to the bathroom, and do multiple little walks throughout the day. If it's nice outside, you'd like to go for a little walk outside, feel free. And as you're feeling more up to it and you're recovering, you can stretch it to longer, fewer walks throughout the day. But that is your main exercise for that first 8 weeks. We really ask that you not do any other exercising while we're letting you heal initially. I mentioned the collar earlier. You will be in a collar at all times. If it's a 1-level fusion, we just put you in a soft collar, and initially for 2 levels or more, you will be in a hard collar for the first 4 weeks, and then we'll transition you later into a soft collar. So typically we ask that you wear that collar at all times except for showering. It's okay if you take it off then. And at night is really probably one of the more important times to wear it, because that's when you can get your head in a funny position and not be conscious of it. As far as showering goes and wound care, the incision itself can get wet starting about 48 hours after surgery, so the 2nd day after surgery. You'll go ahead and take the outer gauze bandage off, shower like normal, letting that soapy water trickle down the incision. That's completely fine. We just don't want you to let the water pound on the incision, don't scrub the incision, don't let it soak under a pool or a bathtub, just showers only. And then once you're done with the shower, you just pat it dry and put a new gauze bandage over it, and then your collar. Really, the main goal is to keep it clean and dry. No ointments, lotions, creams, or anything like that needs to be put on it. With the medications that we give you, especially the pain medicines and some of the medicines you receive during the surgery, they can slow your belly down a bit, and constipation can be an issue. So we do recommend that you stick with a stool softener initially, as long as you're on a narcotic. If that's not enough, you can step it up to laxatives if needed. Of course, if you were to switch over to diarrhea, you should stop all of that. But typically, stool softeners can be helpful while you're on a narcotic to limit or stop any issues with constipation. As far as driving goes, we ask that you not drive as the driver for up to the first week after surgery, mainly because we want your neck to be healing, you're in a collar, and you've been given some strong medicines during the surgery with anesthesia, as well as the pain medicines you may be taking at home. So typically by week 1, when we see you at your first post-op visit, we'll see how much of the pain medicine you're really needing at that point, if any, and get you cleared to drive. When we do clear you to drive, the rule with that is actually you're going to drive with the collar off, so that you could check a blind spot or the areas around your vehicle if necessary, but trying to be conscious not to move it as much as possible and use your mirrors. But we'll discuss that a little further at your first post-op visit. As far as work goes, you're welcome to work from home whenever you feel up to it, but otherwise we ask that you take a little bit of time off of work. And office type or sedentary type jobs, you could get back into the office within that first week or so when you're feeling up to going. Usually when we do get you back to work, whether it's a week later or 3 weeks later, whenever the case may be, we do usually recommend that you try to go back part days at first. Because of the general anesthesia and all the medications, oftentimes you get really wiped out by things. And so going back to work a full 8 to 10 hour day right away is often too much for you, and you just get too tired and too sore. So if you have the capability of going back part days for that first week back to work, that's typically ideal for patients. And then you can advance it to regular hours as you tolerate. For those of you who have more physically demanding jobs, like construction workers or someone who just has a generally physical job, we typically have you out of work a bit longer though. Unfortunately, we need to have you get through physical therapy before we can clear you to full duty. So you're looking at closer to about 3 months until full duty for physical work. As far as complications that can be seen or thought about with this surgery, swallowing, of course, is mentioned again, swallowing difficulty. If there's any worsening swallowing, we want to know about that. Voice changes, you may notice a little bit of hoarseness because of the approach and working around the nerves that control the vocal cords. Incisional pain is typically not too significant. There's not a lot of pain. There may be some mild pain around the incision or numbness. Your typical post-operative pain with this surgery is going to be back of the neck pain. So back of your neck, upper back, shoulder area, that's your typical post-op surgical pain because of the stretch of the joints and muscles during the surgery. So we definitely give you the muscle relaxants to help with that, because oftentimes the pain medicine alone isn't good enough, and the muscle relaxants help more than anything. You can also use heat and ice back in the back of the neck and upper back as you need to as well. As far as any persistent arm symptoms, weakness, numbness, tingling, pain, those types of things, some of that is oftentimes expected after surgery, and the nerves do take a while to heal. They do take quite a time to heal, and so it just is a slow process of all of the symptoms going away. We typically will anticipate that people will have improvement, if not full resolution of their symptoms after surgery, but in most cases people feel much better, but they do have some symptoms still lingering after the surgery, and that's completely normal. I usually tell patients I expect that you have less frequent or less severe symptoms, but it's okay to have some symptoms still in the arms or hands, and that will slowly improve with time as the nerves are healing. On a rare occasion, a nerve will get aggravated that we were in there, and the most noticeable nerve that this happens with is the C5 nerve. So if you're having surgery at the C4-5 level, which is where this nerve exits, it's a little bit more of a temperamental nerve and can flare up after surgery. Sometimes people will wake up with what we call a C5 nerve palsy, where they have significant weakness in the shoulder and bicep, lifting their arm, lifting anything with their bicep. That's usually where we see this. It doesn't happen all of the time when we operate at C4-5, but it's just the most temperamental nerve, so we mention it because it's more common to have this be irritated during surgery. If that happens, or if you have any nerve irritation after surgery, even at other levels, sometimes a nerve gets a little aggravated that we were in there, and you could wake up with the same level or increased level of nerve symptoms. If that happens, we'll use some medications to calm down that acute inflammation and irritation, and we'll watch things closely with you. As far as the spinal cord, there's always that question of paralysis. We do monitor the spinal cord with the neural monitoring, and we're very slow and meticulous about working around the spinal cord at any time to limit and really eliminate chances of paralysis with this surgery. As far as when to call us, anytime you're seeing changes in strength, increasing weakness, we want to know about that. Increasing pain, numbness, or tingling, symptoms like that are getting worse, we definitely want to know about that as well. As I said before, sometimes the nerves are still irritated after surgery and need to take time to heal, and sometimes you'll notice good days and bad days. But as long as it's a up and down, overall things are improving, that's normal. But if you're noticing that you're having increasing symptoms that are just not calming down, that you're concerned about, please notify us and we can chat about that. Any persistent fever or signs of infection that you're having, definitely call us and let us know. Any persistent nausea or vomiting we can help out with as well with anti-nausea medications if necessary. And again, we talk about swallowing. So any worsening ability to swallow or difficulty with your swallowing, let us know if it's getting worse and you're having more limitations in what you're able to swallow. As far as when you'll see us next, we typically see you for your first post-op about 7 to 10 days after surgery. And at that visit, we'll remove any sutures and steri strips. We'll take x-rays at that time and go over them with you so you can see them, answer any questions that you have, refill medications if necessary. Overall, just check in and see how you're doing. Typically after that appointment, you will be able to drive. We'll get you cleared to drive. In most cases, people are not needing pain medicines much after that appointment because, as I said before, it's not typically at that painful of a surgery. So we'll discuss that driving and clearing you to drive at that first post-op visit. We'll then see you 4 weeks after surgery and get another set of x-rays at that time. In fact, we'll get x-rays at every visit to watch that fusion and monitor that with you. We'll then see you at 3 months after surgery, 6 months after surgery, and 1 year after surgery. And getting you back to normal. At 4 weeks after surgery, we'll transition from the hard collar, if you had 2 or more levels fused, into a soft collar. If you only had 1 level fused, you'll stay in that soft collar for the first full 8 weeks. And at 8 weeks is when we transition out of the collar altogether and start physical therapy for strengthening and stabilization of your neck. We will give you an order for that physical therapy to start after that 8-week appointment. And then in conjunction with that physical therapy, you can go ahead and increase lifting activities and your normal physical activities. The physical therapist can help guide you in getting back into your own exercise routine, sports, physical activities, whatever you like to do. I always like to mention to people that fusions can take up to 6 months to fully fuse, but we will monitor it regularly with x-rays at your post-op appointment. So So hopefully this has given you a good amount of information on things to expect with the surgery, the day of surgery, during your recovery period. But again, please feel free to call us or email us at any time if you have questions throughout this whole process. Thank you.